There's not a team member out of our 600 people who did not contribute in one way or the other to our ability to keep this hospital open and available to the people of this community.
Our initial conversations on the preparation for the coronavirus was first surrounding how do we protect patients and our employees.
We acknowledge that we need to have a systematic plan, one that addresses not only the safety and health for the community, but also for those members of our team here at the hospital.
The first thing that we really looked at is where are we going to test people and where do we have the capacity to make physical changes in the air handling system.
We're still a functioning hospital even during the pandemic, so it was important for us to understand and to really figure out how we could still take care of patients who need our care. And one of the exact reasons why we stood up our respiratory clinic is to try to protect those patients.
We opened a respiratory clinic that became the one and only testing site in Steuben County.
We were able to bring in negative air pressure to the facility.
We're bringing all the air in to the room and then out to the environment, and we're not keeping it in the building.
The foundation is really the philanthropic arm of Cameron Memorial Community Hospital. We are here to assist the hospital by raising funds so that way we can have special programs within our community. Cameron Hospital Foundation was able to assist during the pandemic by really providing face masks to all of our local schools.
The local business, Miller Poultry, who we partner with and value very much in the community, came to us with a request to help them with testing.
Miller Poultry employs between 800 and 900 people. And they had noticed that they were starting to see some positives among members of their staff.
And in typical Cameron fashion, we said, of course we will help you.
So we were quickly able to develop our process to go on-site to Miller Poultry and provide them with on-site testing.
And over the course of just a day and a half, we tested over 800 employees. In the week that we launched Incident Command and began all of our COVID activities, we opened a pediatric practice with Dr. Freyer. We opened our family medicine clinic in Fremont, Indiana, with Dr. Fowler, and we hired a director for our Cameron Medical Group.
We've assessed this opportunity for a retail pharmacy for about 10 years here at the facility.
And finally, the 1st of 2020, we were able to open retail pharmacy in the medical office building on the first floor. That offers the patients convenience as well as cost savings.
During the pandemic, we also partnered with an outside corporation, Sodexo, to improve our food service.
If we want to reward people on the night shift, one way that we can do that is we can feed them. So food services are very important to a hospital under normal circumstances. They became infinitely more important to us throughout the pandemic.
The preparation to start administering the COVID vaccines actually started in September when we were contacted by the Indiana Hospital Association.
Cameron again stepped up without knowing what would be involved and said, of course, we want to be part of the vaccination process. And we were ready to vaccinate our first person the day after the vaccine was received. As it turned out, we would become the one and only place for vaccination for healthcare providers in 4 counties.
And I'm very impressed as a member of the hospital board, as well as a community member, that we were able at Cameron to offer that service.
The response of the people that were able to receive the vaccine, there were tears. It was very emotional.
Oh, this is going to be hard. They have been so amazing. Our frontline people, month after month, week after week, day after day, came in when their families and when their neighbors and their friends were all staying home.
Well, the frontline workers responded exactly as I expected them to, because that's exactly what they do every single day.
Our frontline staff have really stepped up and have done a great job taking care of those friends and neighbors who we call patients.
I've been in healthcare for over 50 years, and I have never seen a team response the way the Cameron team has responded to COVID across the board.
What I think the community and the hospital shared is that recognition that we really are interdependent.
We were probably, I think, the premier hospital for this region because of the things we were able to accomplish. I've heard so many positive comments about how the hospital stepped up and helped the entire community.
The community really showed Cameron that they appreciate what we do. We were overwhelmed with the donations from companies, the personal gratitude cards.
So it was great to see the community pull together and really support us in the time that we were trying to support them.
I think we've demonstrated that we can keep our communities safe and that we can provide for them the best general medical surgical care in this region.